Hello everyone, my name is Jasmine White and I am a 21-year-old ASN nursing student going to my 4th level. My expected graduation date is December 2025. I have a 2-year-old son named Dallas and he is my world. How did you learn or hear about this position? I heard about this position through different opportunistic festivities that was held throughout your facility. I did the Nurse Tech program for summer 23 and currently in it now. I've done the open house that was held to view the different units. And I've also had my clinical rotations at your facilities, at all three, numerous of your facilities. Tell me about your work history. I worked at Popeyes. That was my first job when I was in high school. I was like in the 10th grade, and I've learned communication skills there. That was my first time communicating with anybody due to sales or just satisfying a customer. My next job was Academy Sports and Outdoors in Bossier. I worked there for a couple months in 21, right after I graduated, and there I learned how to do teamwork, work as a team, communicate with customers more, perfect my communication skills, learn how to do customer service and just satisfy my customers, honestly. And I was more so focused on making sure my customer was satisfied, or if an elderly patient needs help doing something or something like that. And that's how I knew I needed to be in the nursing field where I can be more helpful in that area. Tell me about your clinical rotation. So far, my favorite clinical rotation was my OB rotation. And I just love seeing women having babies. Like, it'll light up their world. It will light up their world. And they just be so happy to have their babies. And I just love it. Because I know I was happy to have my baby. And just to see different women see that experience, it's just touching, you know. My least favorite was neuro, and that was only because of the facility. It wasn't because of neuro. It wasn't a teaching moment. It was just a bad rotation. That's all it was. I have not had my critical care rotation yet. That's why I have not said critical care, because that's in my 4th level rotation. What are your strengths? What do you need and want to work on? My strengths is critical thinking. I think as far as much knowledge that I've learned so far, I think I can use everything I know to critical think my way through a situation. Plus not prior, but more knowledge to come. And I think my weakness is I'm sorry. My weakness is, it's just embarrassing to say, but my weakness is time management, honestly. If anybody knows me, they know time management is something that I struggle with, but I know I will. It's getting better than what it used to be. I know if I need to be there at a certain time, I will be there at a certain time. So as far as job-wise, I will be on time, on your schedule, as I need to be. I promise. What are your career goals, dreams? What's your plan? My career goals is to go back after I get my ASN degree. I want to go right back probably the summertime and get my bachelor's in nursing. And then after I get my bachelor's in nursing, I want to go back for my nurse practitioner, because I want to be a critical care nurse practitioner. I see myself about 5 to 6 years being a critical care nurse practitioner. So, tell me how you would handle this situation. You observe the UAP entering and leaving a patient room without washing her hands or using the alcohol-based gel. What do you do and how